Marfan Syndrome by Kenneth Remoe-Doherty. What is Marfan Syndrome? Marfan Syndrome is commonly known as MSF. It is an autosomal dominant disorder that specifically causes mutation of a gene called fibrillin 1 or FBN1. Causes of Marfan Syndrome. The FBN1 provides a genetic roadmap for producing a protein called fibrillin 1. Fibrillin 1 then binds to other proteins and molecules to form a filament called microfibrils. Microfibrils become part of the fibers that provide strength, flexibility to connective tissue. Risk factors. Since Marfan syndrome is a genetic disorder, it is often passed down from one or both parents with the gene. Therefore, if one parent is affected, each pregnancy has a 50% risk of inheriting the mutated gene, resulting in a child with MFS. Marfan syndrome affects men and women equally. The incident rate is equal among all races and ethnic groups. 25% of Marfan cases result from a new mutation of FBN1. Screening and prevention. Screening would involve doing a thorough physical assessment, reviewing of the family history, and identifying ones with Marfan disease is key. It is recommended that genetic testing be completed on patients with a family history, and there is no way to prevent Marfan syndrome. Signs, symptoms, and complications. Other physical findings noted on examination would include the following: tall, thin build, disproportionately long arms, fingers, and toes, flexible joints, and flat feet. Pectoral deformity is also a condition that can be found in Marfan syndrome. This is where you find a sunken breastbone. The picture below to your far left shows the actual deformity, and the picture on your right shows a repair after it was repaired. The picture was retrieved from medline.org. Marfan causes scoliosis, which is an excessive curvature of the spine. Complications continued. Heart palpitation and murmurs can commonly be found in this syndrome. Also, aortic root dilation. This is prominent in Marfan syndrome. It causes the aorta to dilate, which leads to dissection or regurgitation of the aorta. This is the primary cause of morbidity and mortality in this disease. Diagnosis. There is no single test that can diagnose Marfan syndrome. Physicians use the Gantt criteria to help identify patients at risk. The Gantt criteria assesses eye lens movement, physical characteristics, and the diameter of the aorta. Treatment. There is no cure for Marfan syndrome. Treatment is typically aimed at early detection of the individual disease process, prevention, and treatment of further complications. Annual ophthalmological evaluation is recommended. Initial echocardiogram should be done to assess aortic root and ascending aorta stability, and every 6 months thereafter. If there are any changes noted, the patient should be referred to a cardiologist immediately. Clinical practice guidelines. The recommendation of 2010 American College of Cardiology, American Heart Association, American Association for Thoracic Surgery, Thoracic Aortic Guidelines, they recommend that a genetic testing for first-degree relatives of patients with a gene mutation. Fun fact, Abraham Lincoln, the 16th President of the United States of America, was believed to have Marfan syndrome based on his physical characteristics. Resources used for family, client, and family education include National Marfan Foundation. This is a website. It is www.marfan.org, and they provide support groups and teaching for patients with the disease process. Mayo Clinic also is a good resource for family members and patients. They also provide appointments for treatments with patients with Marfan syndromes, and they tend to accept different types of insurances across the United States. Up to Date provides basic patient teaching of Marfan syndrome written at a fifth grade reading level. References include NIH, Medline, Mayo Clinic, as indicated. Thank you very much for listening.